With our infectious respiratory diseases, there's all kinds of things, viruses, fungus, bacteria, that can all cause an infection, and it can happen in either the upper or the lower respiratory system. So, for instance, an upper respiratory could be like a sinus infection, pharyngitis, which is just a sore throat, or some kind of rhinovirus, common cold type thing. These upper respiratory infections are usually not life-threatening. Very rarely are they life-threatening, with the one exception being epiglottitis, which is a bacterial infection that causes swelling of the epiglottis. So that can lead to an airway obstruction, so that could be a potential life threat. Your laryngitis can occasionally result in some respiratory distress with some stridor, and croup, or laryngeotracheobronchitis, could produce some stridor as well, but croup is usually seen in children and not very common in adults. Now, your lower respiratory infections can lead to impairment of oxygenation and become a potential life threat. You've got pneumonia, the flu or influenza, acute bronchitis. These are the most common lower respiratory infections and can occur in a patient of any age. Now, RSV, or respiratory syncytial virus, is fairly common among children and usually is found during the wintertime and can occasionally require hospitalization. But that's going to cause your inflammatory response in the bronchioles, or so you might also hear it called bronchiolitis. Now, some other less common but very severe problems could be like severe acute respiratory syndrome, or SARS. This is caused by coronavirus. You also have Middle East respiratory syndrome, or MERS. And then you've got stuff like the hantavirus, or the hantavirus pulmonary syndrome. Now, to be fair, these have not been reported in quite a few years, but there's always a potential for a new outbreak of SARS or MERS or other similar respiratory virus. Now, the hantavirus is spread by your deer mice and is typically going to be over in the west, like Arizona, Colorado, New Mexico, Utah, things like that, in between there. You do have some other ones, pertussis, which is the whooping cough as well, but it's due to widespread vaccinations for pertussis, it's fairly well under control, but is usually more of a concern for infants or small children versus adults. So we're going to talk about a couple of specific respiratory diseases. This is not an all-inclusive list. This is just some of the ones that you are more likely to encounter. Right? So pneumonia. Infectious disease, and what it's going to do is cause this inflammatory response in the lungs. Okay? And what happens here is that whatever's causing the pneumonia, bacterial, viral, whatever, is actually infiltrating into the lung tissues, and it causes this inflammatory response, which is going to cause increased fluid to that area, things like that, and it's going to create respiratory difficulties. So pneumonia, in a young, fairly healthy person may not be a super serious disease, but in an older individual or someone who has a weakened immune system can be fatal. Now, pneumonia a lot of times will be classified as just standard pneumonia or nosocomial or hospital-acquired pneumonia. And in fact, a lot of your elderly patients or patients with weak immune systems may actually get a vaccine for pneumonia if they're going to be hospitalized to avoid that risk or to minimize that risk. Right, your patients with your asthma, your COPD, heart failure, other things like that, and smokers as well are at increased risk of pneumonia, which can actually make those underlying respiratory conditions even worse and exacerbate them. So then you get a double whammy. All right, so the risk for this, like I said, goes down dramatically when you have immunization, and it's recommended for the elderly and the very young who have conditions that may make them more susceptible to disease or infection. Now, with your pneumonia, it's fairly common in patients who are immobile for whatever reason or who live in extended care facilities. It also can be a secondary complication of other lower respiratory infections like the flu. And in fact, a lot of your flu patients that end up dying, they have developed a secondary case of pneumonia. So these patients with pneumonia can be very, very, very sick. And they'll usually present with a cough, difficulty breathing. They may have shaking, chills, fevers, just general malaise, just not feeling well. In the elderly, if they are people who have a decreased immune response, they may or may not have a fever, so keep that in mind as well. Now, with your patients here, dyspnea and respiratory distress is going to range greatly depending on their overall health status and how severe their case is. So it may be very mild or it could be very severe dyspnea. It just depends. Their cough is usually going to be productive, meaning they're coughing up sputum, and it will usually have kind of yellow or rust color. And the rust color is because they're actually could be coughing up some red blood cells as well with that. Now, with pneumonia, it's going to occur in one or more lobes of the lung. So when you auscultate, you'll be able to hear breath sounds diminished in the affected areas, and you're not going, but usually it's going to be just in that one affected area. But keep in mind, you could have more lobes infected. So you may be only in one lobe, one area of one lung, or it could be in multiple areas of both lungs or one lung. Sometimes with your pneumonia, it can be kind of difficult to differentiate between your pulmonary edema or your pneumonia, but your basic treatment of the hypoxia and that ventilation problem is going to be the same. All right, both patients are going to require supplemental oxygen, often by non or breather. Patients with pneumonia tend to be dehydrated and need fluids, though, whereas your pulmonary edema, they don't need fluids because they're in fluid overload. All right, so make sure that you listen very carefully and you do a very good assessment and a very good history on this patient. All right. Your protocols may allow you to treat any wheezing caused by either bronchospasm or inflammatory response in the lungs. You need to make sure that you know why you're giving albuterol in this situation, not just. As far as your IV fluids, they're going to be dehydrated, but also when you get dehydrated, the mucus buildup gets thicker and gets harder to get out, to cough it out. So the fluids are going to kind of have a double whammy effect on it. It's going to rehydrate the patient, but it's also going to help when they get rehydrated start thinning that mucus and make it hopefully a little bit easier to get out. Now, your acute bronchitis is an inflammation of the bronchi with increased mucus production. So the presence of this mucus in those large airways produces that rhonchi that's heard when auscultating the lungs. And anybody can get bronchitis, but your smokers and your patients with lung diseases are going to be at a bigger risk for developing it. And acute bronchitis can actually be caused by viruses, bacteria, or irritants. So there's a lot of different kind of triggers for it, if you will. So your signs and symptoms with acute bronchitis: wheezing, coughing, shortness of breath, fever, chills, malaise. Typically have a productive cough, and the sputum may be green, yellow, or even streaked with blood. So our treatment sounds a whole lot like pneumonia, doesn't it? Our treatment is going to be oxygenation to treat any dyspnea or hypoxia. Okay, we're going to, if they're wheezing, we may want to do a nebulized bronchodilator like albuterol. IV fluids can be beneficial as well, so we want to consider IV here as well as fluids if they are dehydrated from decreased intake or fever. Now, your assorted viral respiratory diseases, flu, SARS, hantavirus, there are a lot more here than are listed, but just a couple of them, they're all viral diseases and they can all lead to death from hypoxia. Most strains of the flu are not going to be fun, but they're not going to be life-threatening, but it can be fatal, so they are very important to take seriously. Right? There's lots and lots and lots and lots of influenza viruses. It's very common and it's seasonal. It can affect anyone at any time, really. But the very young, pregnant women, the elderly, and immunocompromised are usually the more susceptible to your complications. All right? Especially like pneumonia, like we discussed a few minutes ago. So your common signs and symptoms: malaise, fever, muscle and joint pain, cough. All right, influenza season starts in the fall, it peaks in the winter months, and then usually tapers off after spring, but it does what it wants to do. Sometimes you get an extended length, sometimes it's just not that bad. It just depends on what is going on each year. Always a good idea, go ahead and get your flu shot. At least have a little bitty bit of protection there. Tuberculosis is another disease, and this is spread among people who spend large amounts of time together. So this is people who live in a homeless shelter together, or maybe an extended care facility or college dormitory or something like that. Usually in order to contract this, you're going to have to spend a fair amount of time in an enclosed space with this patient or with this person. It is curable with antibiotics. It is an airborne transmission, so you need to be extraordinarily careful. All right, so when you have a patient, when some of the hallmarks here, they'll have progressive fatigue, night sweats, weight loss, malaise, a productive chronic cough, low-grade temperature, may have some pleuritic chest pain, things like that. This is what we get a TB skin test for. You should get annually if you're in EMS or healthcare in general. And if you ever have a positive TB skin test, then you're going to have to do x-rays from here on out. All right? Now, with their TB, as far as PPE goes, it needs to be like Oprah on the Christmas giveaway show. N95 for you, N95 for you, N95 for everyone, okay? Except for your patient, because N95s, if you've never put one on, makes it kind of difficult to breathe a little bit through it. So you and your partner, anybody else that's around, needs to get N95. It's going to be around that patient. And the patient gets a surgical mask and or with oxygen with the surgical mask there. Sometimes it can be kind of hard to decide if you want to use respiratory droplet precautions or not. It's not always easy to differentiate between your respiratory viral infectious things or, just like something that's not infectious when it comes to respiratory issues. So typically, we're going to think, okay, whatever it is much more likely to say be the flu versus like SARS or MERS. But I don't know about you, I don't want to take any of this crap home to my family. So make sure you wear a mask. Go ahead, put it on. You look kind of like a goober, that's fine. We all do. Nurses may look at you funny when you come into the ER with N95 on. I would rather have that any day of the week than have, potentially develop meningitis or TB or something like that.